Welcome to the Whole Health Podcast,
where a functional nutritionist and a biological dentist investigate the interconnectedness of your health.
Let's get started.
Megan.
Kelly.
Glad to be back with you. So this is going to be one of our opportunities for, I don't necessarily love the term case review, but for the sake of those who listen to the Whole Health Podcast, I know it's important for both you and I to display that we actually work as a team. So a dentist and a functional nutritionist putting our brains and our listening skills and our experience to work to better help people get to the point of health or experiencing lives where they're not feeling burdened, as they often are when they come to see us. So I thought today we would talk about Katie from Kansas. So let me give you a little backstory to how she came to find me.
Great.
Because that's really where it started. And for those of our listeners who aren't aware of this, so often people are coming to see me. They've, heard me talk on a podcast or whatever, maybe read some of my stuff on Instagram at Blodgett Dental Care. And they come to Portland, Oregon for our help. And they've oftentimes been through every other avenue of healthcare experience. And it's kind of like dentistry is the last stop on the health train. So in Katie's situation, her backstory is that as a teenager, she started getting tooth decay, had something to do with her nutrition and diet, I'm sure, and drill and fill, and they're filling with mercury fillings. And, for context, she's in her mid-50s. So this is going back 40 years. She's getting a mouth filled, mostly her back teeth, with mercury fillings. And when I say mercury fillings, most people are going to hear of these things called silver fillings, but in fact, they're 50% mercury, 50% tin, copper, and silver. But they look shiny and silver, right? Not too long after she had these fillings placed, one of the teeth started to hurt, and she had her first root canal in her early 20s. And as you progress along her life's journey, many of the teeth that she had the mercury fillings placed subsequently started to hurt or they fractured, and so more root canals. And the way she described it to us when she was actually connecting with Heidi, our new patient specialist, she was saying, I noticed tastes in my mouth. And at first it was more of a metallic taste. And then after she had had a couple or a few root canals, she was describing it as like a paste like flavor, which is really disgusting. And she decided ultimately, as she was feeling less and less well, to start taking out some of these teeth. Initially, they were root canal treated teeth that were painful. Like, they did the root canal. Dentist says everything looks fine. She says, yeah, but it still hurts. And, at long last, she finally started having this tooth removed, that tooth removed. By the time she came to me, she no longer had any upper premolars or molars. So 10 of her 16 upper teeth were gone.
Wow.
On the lower arch, her lower teeth, all of her molars. So 6 of those 16 teeth are gone. So she's missing literally half of all of her adult teeth. So when she came to us and shared this story, and I recall that, Claire was the one who met with her. Her goal is, I want new teeth. And she had already been to another biological dentist, I think maybe in Utah, who had cleaned out bone because when she had her root canals taken out, they didn't remove all the infection. And so the bone didn't heal well. So she'd already been somewhat down this path of trying to get her bone healed well so that she could have some implants, ceramic implants. But that bone wasn't healing well. So when I meet her for the first time, I'm thinking to myself, does your body have the ability to heal? And, prior to you and I knowing one another, I would have been really stumped because I don't know who, to whom would I send them? So the first light bulb going off in my mind is like, well, you're already in Portland. How do you feel about seeing a functional nutritionist? So from a dental standpoint, she's lacking a smile.
Yeah.
So when she smiles, all you see is canine to canine. We call it the social six, but it's darkness beyond that. And I'm suspicious that she probably has some emotional issues around that. And I'd love to get her some teeth, but I don't know that the foundation from her whole health is well enough to work with that yet. So I then referred her to you, and Katie came to you. Yes.
Yes, she did.
So how'd things go for you all?
Yeah, and thanks for that backstory because you and I, when we're working on a case together, and we're both very busy, so we download each other, right? And that may be in an email. Sometimes we're texting, somebody's coming to see you, to pay attention to this or pay attention to that sort of a thing. But we don't always get to sit and have a full conversation around your experience of that patient. And you and I both know as clinicians, when you're sitting with somebody, it's not just their words that you're listening to, but it's everything about their energy that you're trying to pay attention to as well to see how you can support them best. And that nonverbal communication can be a large part of that. So it's a different experience to have somebody in your clinic, right? As they're always eventually in your clinic, but I do telehealth all around the country and even the world. So sometimes it's virtual, right? But when somebody's sitting there, it's a different thing. So when Katie came, there was an insecurity that was really apparent when she literally walked in the door, right? And sat down, a shame that was coming with this condition she was wanting to resolve with you, or this long history of oral health issues. And I think sometimes when you send people to me, they're like, okay, well, Dr. Blodgett said I need to go see this person, but they're not necessarily as bought into what I'm about to be discussing with them as they are about what they've been discussing with you, right? And so I wanted to help her understand this was going to help her get to her goal, but better understand really, like you said, what's the whole story here about how she even arrived at this point with her dental and oral health? Because rarely is it a mouth issue, period, right. End of story, right? If tissue is breaking down in one part of the body, it's typically breaking down in a lot of parts of the body. So that's what I was curious about. I wanted to understand her fear, her insecurity, what felt like shame, because I wanted to help her know that it was going to be okay. We're going to figure this out, right? And we're going to prepare your body for this procedure that you want to do with Dr. Blodgett. But I was deeply concerned that there were some underlying issues with biochemistry and potentially with the structure of her body where she wasn't going to receive that procedure with success. And she's not the only person that we've worked with where we have those concerns, right? Yeah. This comes up. We want to ensure that they have excellent healing. So some of the things that came up in working with her, she allowed me to run some labs on her, which really helps me figure out on a more granular level what we're dealing with. And aside from the dental health issues, she was sharing with me that she felt fatigued. She felt a lot of brain fog. She said that she was having word finding issues, and that was more recent for her in the last few years, where she couldn't find a word, or she just had a conversation and she couldn't remember exactly what had happened in the conversation. That starts to cue up my mind that something could be going on in this route or this route. But she was also sharing that she had significant weight loss and muscle loss. So of course, then we're thinking tissue again. It's like, okay, well, what is going on here? It was interesting because she shared that she struggled to eat, to remember to eat. And one of the other things that was profound about my conversation with her is that she circled around the word stress. It was really interesting. She did not want to use that word. She said pressure or There's been a lot going on. So do you feel a significant sense of stress physically or psychologically? Well, there's a lot of pressure. There's a lot of overwhelm. And I thought, oh, this is so interesting. This is maybe a conversation she's having with herself about not wanting to use that word, because then you have to accept that word, right? And I'm all for you choose your words wisely in whatever way is best for you, right? But she did not want to use that word. But she did share there was a lot going on in her life over the previous couple of years that was impacting her ability to eat. So from a functional nutrition perspective, there's sort of the macro and the micro when we're thinking not just about our nutrients, but really around concerns, right? If you're not getting enough food, period, we have issues. But if you're not getting the right type of food and you're not getting all the little micronutrients in there as well, we're concerned. And that is eventually what we found. So after running labs, micronutrients, and when I say micronutrients, I mean, I run something called an intracellular panel that looks at the concentration of vitamins and minerals in the white and red blood cells. If you run a panel where you look at nutrients in the bloodstream, you can run that every day for a week and you'll see different levels every day for a week because it's impacted by every meal you consume. Sure. Whereas the white and red blood cells live for 3 months. So you get a better idea of generally if somebody is deficient or in the normal range for a vitamin, mineral, amino acid, omega-3s, et cetera. That's about the totality of what we can look at. So in her case, it was profound. She was deficient in almost every micronutrient.
Wow.
I don't see that very often. Normally I'll see, a handful. Very few people are nailing it on everything. It's just hard to get everything we need from food these days, but it was across the board. So when I see that, that's general malnourishment, right? But what was interesting is just in her medical panel, her total protein was very, very low. And that's another sign this person is truly not getting enough food. So, nutrition's my gig, right? So I am thinking about the food, but we also have to think about some other things when we think about tissue, which is your hormone levels, right? We want to think about metabolically, are you able to build tissue effectively? And she had a lot of reproductive hormone deficiencies as well. So we know estrogen's one of those things. It's for women really a growth hormone, men too actually, but when we don't have enough of it, we're gonna have a hard time with bone. That obviously was a big concern for me with her work with you. There's research showing that if you have osteoporosis, which we're generally only testing in, the femur, the hips, the spine, et cetera, it's not like the rest of the bones are nailing it. They're not, super strong in your jawbone, but failing everywhere else.
Right.
So of course we're concerned about that. And then something else that I thought was interesting was that her ferritin was high. So that's a storage of iron. It's a measurement of a storage of iron. And there's a couple things that you think about when you see this. You think about a potential genetic mutation called hemochromatosis, where the body absorbs iron at a really high rate, doesn't let it go, but it puts pressure on the liver, significant pressure, and then can cause more of a toxic buildup in the body. So I'm thinking about somebody that's had mercury fillings, and there's any indication that their liver may not be functioning optimally, extra concern, right? She's not going to move these things out of her body the way we need them to. And it's, of course, not just metals. It's all the junk our body is constantly trying to filter. But the other issue can be non-genetic, but the liver is struggling. The liver literally can't break the iron down in the body and get rid of it. So it's not necessarily coming from the genetics. It can truly be coming from it's not organ failure by any means, but it's a lack of efficiency within the organ, within the liver to get rid of this iron. And so that also got my mind going, okay, what do we need to do to support this woman's ability to clear things out and get a healthy functioning liver again so she can move forward with you. So from there, we went on to work very hard to replenish these nutrients. And that's not just through supplements. We're all fans of our supplements, right?
Not one pill for me?
There's not one pill. We had to get her eating. Yeah. And this has proven to be one of the biggest challenges because when you are experiencing overwhelm, stress, call it what you will, trying to override your unique response to that, right? Not everybody loses their appetite in stress. I don't. I go the other way. Yeah. But we needed her to start eating. So we built a plan of smoothies, actually, because she had no issue with drinking something. She just couldn't push herself over the edge to necessarily sit down and eat a meal. And so by doing that, we were able to add meal replacements into the smoothies, extra nutrients, and a supplement plan. And we're moving along our way now to replenish her body in tandem because she's out of state. Yeah. And while I can work with somebody out of state, medical support out of state, we have to find a partner. So we have worked on finding a provider for her that will help her with bone density and also with thyroid replacement because her thyroid was a little out of whack, which can happen from malnourishment. But sometimes it's hard to break that cycle until you get a little thyroid support. So that's how we've moved forward with her care at this point.
I would think, of course, I can't help but see through the lens of oral health and dentistry. I would imagine when a person starts experiencing trauma to their mouth at a young age, and I don't have any studies on this, so I'm just thinking out loud here. But when your teeth hurt, or it'd be like if your leg hurts, you're probably going to favor it. I talk every week to people who are like, I've got this one tooth that hurts, so I've been chewing on the other side for 3 years.
Right.
And I mean that's life. And here she is today without a single back tooth on which she can chew. So I mean, not to overuse the term, but from a functional standpoint, how the hell are you going to chew anyways?
Absolutely.
She could be stoked to go have a steak and there's literally no way to chew it.
Yeah.
So I imagine there's both some physical and some emotional components to that.
Well, it's true. And it's interesting you brought that up because one of the things we talk about a lot in practice, and this did come up in Katie's case as well, is chewing is the first step of digestion. We often forget that, right? And if anybody has ever challenged you to chew 30 times, have you ever tried that?
Oh, yeah.
It feels crazy, right?
Yeah.
It feels like it takes a very long time and please make this end, but you have fully broken that. It feels like, okay, it is mush after 30 bites. Chews. Well, that's what we're supposed to be doing, right? At least from the mechanical breakdown of the food at first. But one of the things that does is it primes the actual stomach organ to release acid, hydrochloric acid, and the pH of our stomach should be very, very low, like 2-ish, 1.8 to 2.2, I think is the general range that we like to see. So the way that I try to articulate this for my patients when I'm telling them why this is so important is, remember I said Katie has low protein, and you're probably right. She's probably not eating things that take a lot of chewing, which often protein does, right? So the protein hits your stomach, and what should happen in an optimal pH is like those old gangster movies where they drop the body in the big vat of acid. It's really a gross visual, but we've all seen them, right? Yeah. I mean, I don't know. I was born in 80, so it was the thing in the movies in the 80s where the body just sizzles and it's like, you will never find it again. It's gone. Well, really, that's what protein should experience when it hits the stomach. It should break it down in that really significant way. But what happens over time when you're experiencing stress, when you are taking PPIs, if you drink alcohol, if you have a poor diet for other reasons, certain infections can impact the acid in the stomach, is the pH can increase to maybe 4, maybe even 5. And then even if you are consuming protein, it's hitting the stomach and it's like, okay, whatevs, right? It's not breaking down. And then what happens is it moves to the small intestine and it will never fully break down because you really truly don't have the chemicals in the small intestine to do that if the first step isn't done. But that acidity also is the first step of telling the rest of the digestive system to work. So if you don't have a low pH, if you don't have a lot of acid that's moving with that food into the small intestine, all the downstream digestion doesn't work optimally either. So in a perfect world, you're eating this optimal diet, right? But even if we got her there, she's not going to break that food down without digestive support. So that was part of her protocol as well. And even in her case, maybe she's drinking a protein smoothie. It's not that hard to break it down, but really you still have to break that protein down into peptides and then amino acids to be able to absorb it and build tissue. So it's a huge part of supporting whatever good work she's going to do in making these shifts in her nutrition. We want to make sure it's actually entering the body, right?
Yeah, great plan. Yeah, so for our listeners, hopefully if they can take a moment to think about what I'm trying to accomplish to help when people come into my practice, the very first question that our oral health specialists are trained to ask is, Katie, what are the goals that you have for your health?
Yeah.
And we leave it that open, not like for your smile. We might go down that route if they want to, but what are the goals that you have? Because everything's going to be based on what you desire for yourself. So as I look at this person who I can see is, frankly, she looks malnourished.
She does.
Yeah. And the energy that you shared about feeling kind of overwhelmed or unsure of her surroundings or what have you, I'm sensing all that as well. When I provide care, as I'm sure it is for you, my desire is that our outcomes are as predictable as possible so that people have positive experiences. To press rewind in my life, 30 plus years, I got into doing dentistry because God called me to, become a dentist and reverse the negative stereotype of dentistry, which is pretty hard to do given how we've provided care for the last 100 years. So here's this person who's already been kind of shell-shocked by her dental experience in her life. And my goal is I want to help you have the teeth you want so that you can chew and smile, both of which are massively important in life, by the way. Like how we see ourselves when we smile and we're missing teeth, it's significant. We actually just had a team member last week, poor thing, she's on her honeymoon in Portugal, had an accident and broke her front tooth in half.
No.
Can you imagine? You're like at the height of your life, you're on your honeymoon. How awesome is this? And you're walking around literally with a tooth busted off.
Oh no.
And it was impactful on her experience. So that's one tooth. Mm-hmm. Imagine half of them. So hopefully people can appreciate why I then, if I'm using my brain, I am leaning into you because everything that you share, it's so detailed and it would take me as much time as it has taken you to learn everything that you understand. And that would take me another career, and I don't have time for that. So this is where our synergistic connection, and whether it be helping one singular human being, as we are talking about in this case, or talking with any of our guests and looking through our different unique lenses and perspectives, that we can hopefully bring about questions and curiosities to see things through different lenses. So I think in a situation like Katie's here, what I'm hearing is we're getting there, but we're not there yet.
Exactly.
Okay. So tell me more about what are you hoping can be accomplished and so that people can appreciate, like, I won't move forward until you give me a green light.
Yeah.
That's how we can in a respectful manner, work with one another in meaningful ways and in effective ways, right? So where are you all looking to go from here?
Yeah. And I appreciate that so much because I think we think about medicine as a series of specialists with like a primary care in the middle, sort of with a lot of spokes to all these people. And dentists in some ways are the redheaded stepchild too, right? It's like, yeah, there's a mouth. But we should totally separate it from the rest of medicine. But one of the things you and I really love about working together is we connect these dots for people. You're one whole human. All your parts are connected. And ironically, the fact that we've removed food from the mouth conversation is even weirder when you think of where do you put the food? However, when we're we're potentially working with a patient that has been malnourished for many years, has had dental trauma for many years, right? Decades in her case. So this doesn't get fixed overnight. Obviously, we have to take our time to rebuild the stores. You know, it's like putting money back in your savings account after you had to replace your roof. You don't put the money back in one paycheck, most of us, right? We have to do that slowly over time. And that's really what we have to do, is rebuild this, the storage of the building blocks of the body and support the biochemical functioning so she can heal when she does this work with you. And so here's what it looks like over time. Everybody is different. So I don't have a way of saying, well, in 3 months, Katie, you're set, you're ready to go, right? And sometimes there's movement forward and movement backwards, depending on what's going on in their life. And they may be doing really great for a few weeks, and then, oh, geez, I had a rough spot and I didn't eat the way I needed to, and I didn't take my supplements, and I didn't do the other therapies. But in her case, what we will do is we will retest. So we're going to make sure, to the best of our ability, that she's getting the nourishment she needs based on her situation, and that she's had a bone density scan back in Kansas, and that we then give this 3 months. 3 months is the shortest period of time that I would expect to see meaningful change in a lab. Doesn't mean there's not meaningful change in the body in 4 weeks or 6 weeks, but I won't necessarily see that reflected in blood work. And the blood work, the reason that's so important is because we have research that tells us that when certain markers are within these certain ranges, and I'm talking about optimal ranges, not laboratory ranges, but the optimal ranges, your body has a better shot at recovery. And we really do have that research. So we want to lean on what we know in science will prepare you for the best outcomes. And so we will want to look at her hormone levels again. We'll want to see a bone density scan initially, which I don't have yet. So I don't know how severe the bone density loss even is or isn't. Don't know. And then we'll retest the micronutrients and see if we've moved the needle to a point where I'm more confident that if she continues on this track, she's going to become more and more and more nourished and be able to be resilient with this work that you do with her.
Yeah. This is so awesome. I love hearing how your brain works. I think that, you know, in my world of biological dentistry, holistic oral health, what have you, you know, trends come and go.
Yeah.
Currently, I would say, you know, there's trends around the idea of tracking your vitamin D level.
Yeah.
And that's great.
Yeah.
You know, it's a wonderful piece of information, but it's not like if your vitamin D is, 60 and above, you're golden. Right. There's so much more to it. And boy, I sure would encourage those people who are looking for their optimal state of health or experience a better state of health in life, that when they reach out to a biological dentist, let's say, or it could be any dentist, I don't care, make sure that we're thinking broadly. You know, who is making sure that the foundation has been laid from a biochemical standpoint so that your body says, cool, I can totally work with this. It's kind of like, have we built the level of whole body fitness to a subcellular level that we actually have the innate ability to heal? Because gosh, I've certainly seen situations in my career where you've done, quote unquote, everything looked great from a dental perspective. They had great bone. They healed for 6 months after the teeth extraction. Like from the outside, everything looks optimal, and it doesn't work. It's like, well, okay, what didn't we consider in this process? And of course, when we gather more information, and this is why you and I work so well together, we help each other understand when go time is appropriate. So I really do believe, and I think it's an interesting situation for Katie, because she just called my office yesterday. It's so funny that we talked about discussing her situation. And she wants to come back out and see me and have a conversation. And I think that's great. You know, we can certainly have a conversation. You don't necessarily need to fly all the way out to Portland to do that. But I want to be clear with her that until we as a group, we're getting a green light from Megan based on the information we can gather. We can only have so much of a conversation about what is possible.
Right.
So Anyway, this has been a really fun conversation around how we're uniquely seeing a human being's health through our lens. We'll have to come back to it maybe in a year's time.
Yeah.
And talk about, how did things go for Katie from Kansas?
Absolutely. I will look forward to that. Yeah. And it's very fun it's very fun to collaborate when you have practitioners that are asking the most important question, which is why. And then we are both committed to protecting the patient and their outcome. And I think that is apparent to them that we're being prudent about next steps so they get the best outcomes, and they do.
Absolutely. I know that in the past I've had some people who I sent to you, and they weren't ready to do the work, and I empathize with them and say that is absolutely your choice. My choice is I won't be willing to participate in doing dental things without the clearance. It reminds me of 25 years ago when I was a resident at the Portland Veterans Hospital. One of the cool things that they did there is prior to any surgery, if people had issues in their mouth, sometimes they would get wheeled in a gurney to the oral surgery clinic so that we could see, is anything going on in their mouth that we don't know about prior to whatever it was, cancer treatment, liver replacement, what have you, because the dental stuff had to happen first.
Wow.
And I thought, wow, this is a system who's thinking.
We had it together back then. What happened?
Yeah. I don't know, but I loved it because it was it's just so obvious.
Yes.
It's not like that in most dental clinics, of course. Right. So anyway, look forward to bringing that one back.
We'll circle back
in a number of months, but thank you for sharing everything today, and I hope people got some good information from this today, and look forward to seeing people on the next Whole Health Podcast.
Thanks so much for tuning in to the Whole Health Podcast.
If you enjoyed what you heard today, please follow us on social media and wherever you listen to podcasts.
You can find out more about us at thewholehealthpodcast.com.
You can find me on my website, blodgettdentalcare.com.
And you can find me at bioloungepdx.com or learn more about my organic soluble fiber supplement, Fluorosophy, at thinkfluorosophy.com.
We look forward to seeing you next time.